Every conversation can and will elevate you. It's where real talk meets real growth. Welcome back to Level Up. Today I'm joined by Brian, healthcare technology executive, strategic advisor, investor, and an active father. Brian's career has spanned major healthcare IT transformations across the Middle East and beyond. And more recently, he has stepped into a strategic and growth roles focused on scaling partnerships and impact. And we're going to unpack all of this today. But what I really like specifically about your role, that it's not just a tech for tech, it's tech with outcomes, growth, partnerships, transformation, while staying human. So welcome to the show, Brian.
Yeah, thank you, Hakim. Thanks for having me. Excited to meet with you and connect.
Same here. I'm really excited to unpack your journey, learn from your experiences, especially when it comes to information technology, of course, and healthcare and partnerships, leadership. So there's a lot to talk about. But let's start from the early beginnings. I always like to get to know more about you, especially for the audience. So take us back from the early stages, and if there was a moment, that really shaped the direction that you are in today.
Yeah, of course. When I first graduated university, I went to work in Belgium actually, and did a project in Germany, in Dusseldorf, for about 4 months. Very quickly decided that wasn't my long-term vision. Went back home. But yeah, while I was at home interviewing for different jobs, I had a lot of options. And I ended up joining Cerner Corporation, which is now part of Oracle. And what really touched me was they used to have a tagline, because it's personal. I mean, everyone has a connection to healthcare. Everyone has a story. I mean, I remember when I was 7 years old, my mom had cancer for the first time, and then she got cancer again. I mean, I go back through my family history, and everyone has somehow been impacted, throughout their lives. So it's easy to connect with healthcare as a vision, and helping people in general. So that's what really attracted me to healthcare. And then having the ability to pair that with technology, software, and in a consulting capacity where I got to travel and see the world. I was really excited about that.
Really nice, really inspiring. And like you also went into a specific direction, partnerships, which absolutely it's not the easiest in a normal segment, but it's even more complicated in healthcare and more complicated in the regions that you worked with. So tell me a little bit about this.
Yeah, of course. Maybe I start with my background, or when I started with Cerner. I mean, I was in the U.S. I spent about 2 years there. I was traveling extensively, and so I got to meet a lot of clients. I think I worked with 30 different clients over 2 years.
Wow.
Spent a lot of time with the Ascension Health Team, one of the largest healthcare organizations in the U.S., and that was great. I was trying from, I would say, day one to venture outside the United States. I wanted to, work in, I would call the global or the non-US space, which was a great opportunity. I finally had that chance when I moved to the UK in 2007. Spent about 4.5 years with the team there. Loved every minute of it. My background initially was implementation, so understanding software at a deep level. When I first started, we did a rotation in support. And so, I mean, you really see from the problems that people have and then going and implementing it and changing processes, making deep discussions with clinical teams, nursing, physicians. And that's not an easy thing to do because they have, I'd say, some important requirements and needs that shouldn't and couldn't be ignored. I learned a lot through that process. I was not an expert from a clinical perspective. I'm still not, but I try to learn as much as I can.
Wow, that's really interesting. I didn't actually know you were more into the technical part, like definitely. But was there's a moment that made you, okay, no, partnerships is my way. I want to go there. I want to manage those big stakeholders. And how did you end up there?
Yeah, no, that's a great question, Hakim. And I'd respond just saying that after I moved to the Middle East, based in Dubai, I was a practice manager for a few years in the Cerner office. So I had a large team, like 35 people, that were doing implementations. And it could be pharmacy, it could be physician workflow, nursing connectivity with devices. But I was really excited to step onto more of the client facing. I missed that part on the management heavy role. And so I was really excited just to go be with clients every day and feel the pain that they feel, understand what pressure they're under, help them navigate the challenges that they've got. And that takes time. You need to build trust. Um, and you don't gain trust just by being there. You have to prove that you're effective at helping them get things done. I'd say one crutch or one thing I could always lean on was I knew how the software worked. I knew how it was supported. I knew the teams involved because a lot of times these health systems have a large vendor that's supplying their IT, but it could be 13 different business units, and navigating which one is going to help them on that day is not an easy challenge
Yeah,
to overcome.
I found this really interesting, Brian, because you had both sides, like the technical part, implementing the software and really things that I have no idea what's happening in this idea. But also, you wanted to see more the other side, which is, of course, facing the client and facing the issues and understanding about the guest experience and the client, of course.
More challenges than I could even name. I mean, the big ones that I found, I mean, understanding at a deeper level some of the technology. When I say technology, the data center piece, the hosting piece, understanding
Yes.
how that works, what levers you can pull to leverage technology to the best level. And then, I mean, some of the other piece was just the commercial aspect because I wasn't initially involved on that. So understanding, you know, whether it's contracts or, scope documents, all of the, I would say, technical commercial details that are important. I mean, you could have the best vision in the world, but if you don't have the
Yes.
right
Yes.
details agreed, then it's not a recipe for success.
Yes, yes, I love that. I love to hear that. We'll come to that later. But my next question, did anybody influence your leadership today? Did you have somebody that you look up to, or it all came naturally? I would love to learn about this.
Yeah, no, I mean, there's a story I love to tell, Hakim. I was working in the UK at the time, and I was actually spending a lot of time with some of our clients in Spain because I speak Spanish. And while I was doing that, the general manager from Spain had asked me to move down to Spain. And I wasn't sure if I wanted to do it, but one of my mentors in the UK at the time, a guy named Jake Sorg, he had given me the advice that said, anytime you've got this important life decision, you should think about it in three different areas. So one is, it's your work. So professionally, what do you want to go do? What do you want to accomplish? And is that opportunity better or worse than where you're at today? Then he said, obviously, you need to look at financials and how is that going to impact you financially? Is it going to support the lifestyle that you want to live? Is it going to allow you to raise a family if that's a goal of yours? And that's really important. And then the last piece is your personal or your family life. Is that opportunity going to be better or worse for your financial, not your financial, your family, your personal future? And obviously, if it's the opportunity you have is better in all three areas, you do it. But
Yes.
sometimes sometimes one thing can override the other two. So I've got a good friend, and a few years ago, he was so focused on improving his professional position and like that he kind of prioritized that above all, and he's done amazing stuff. And over time, it took a bit of a toll on his family, but he's come back. He's stronger. He's developed great relationships. And I mean, similarly, maybe the money's great, but if it doesn't satisfy you professionally, if it doesn't satisfy you personally, you're not going to do it.
Yes, correct. This is really deep, and I don't think everyone, including myself, asked these questions before. But it's good, really good to know. And thank you for sharing your story. It's definitely the place about the real stories. So thank you for bringing it up. We move a
Yeah,
little bit
of course.
to another section or segment, growth, partnerships, and trust in healthcare IT. You have been associated with building and managing serious healthcare IT softwares. Of course, Cerner is definitely one to mention. How do you actually build trust fast in healthcare where risk is real and stakes are high?
Yeah, that's a very important question. And sometimes it doesn't happen fast. Sometimes it happens over time. But I think the most immediate thing you could do is be honest with people. You need to be direct. They need to understand that your best intention is to make their life better. And if you're going to help the person that you're working with and you're truly partnering with them, you're going to help build that trust pretty quickly. I mean, I think it transcends most types of businesses, but if you're truly working with a customer and you have their best interest in mind and you can support that somehow, you're going to build trust by helping them achieve their goals.
Yeah, yeah, that's absolutely to the point. And about being transparent. And I have a follow-up question. You worked in very different regions, very different cultures, from UK, Europe to the Middle East. Like it's totally different. So, what was like a challenge or a habit that you learned from being able to deal with totally different mentality, mindset, and of course the structure of the culture itself?
Yeah, of course. I mean, for me, you have to stay flexible and adaptable. People talk about adaptability, but doing it is maybe a little bit different than just talking about it. For me personally, I mean, if you're managing a team and you have people from different cultures, different backgrounds, different countries, people respond to different things.
Yeah.
Some people are 100% focused on the next title that they're going to get. Some people are focused on the next raise they're going to get. Some people, honestly, they just want to do their job. They want to have their family time protected, and you need to recognize that, understand each of the people that are on your team, and help them navigate in that way. And similarly with a customer, it's understanding what's important to them, where are they trying to go.
When everyone says they want transformation, what do they really mean? And will project usually have, let's say, timeline or expectation? How do you kind of balance this as well?
Yeah, of course. And I think that question you'd answer differently depending on who you're talking to. So if you're working with a CIO, maybe he wants to migrate his organization to the cloud. If you're speaking with a chief nursing officer, maybe she has issues with staffing and she needs to more efficiently allocate her team, or she needs to find a way to save her team time. The same thing on, the medical front. If you're talking with a chief medical officer, is how can I give time back to doctors, because we don't have enough of them, right? There's not enough doctors in the world, full stop. Then when you're talking about it, you're speaking with a CFO or a chief financial officer. I mean, what they want is, how is this going to impact the bottom line? So you're either an expense or you're someone that's going to generate revenue. Maybe you can do both, and help them save money while also making more money. So
That's really interesting. That's really interesting. And of course, every like case would have a different sort of plan or roadmap. So how do you align clinical outcomes, IT, reality, and commercial goals without reducing the momentum or, affecting the progress?
yeah, no, that's good. I mean, for me, one trick I've tried to use is, I mean, almost every organization that you work with, it's almost always true in healthcare, is going to have their roadmap or their strategy or their vision that either someone will share for you. Sometimes it's posted on their website. And I mean, they tell you straight up, this is what we're trying to achieve. We're trying to publish more research this year. We're trying to see more patients. We're trying to open these new facilities. And if you can recognize those overarching, big, audacious goals, then you can support them by bringing in solutions or different services that will supplement what they're already doing. Sometimes if it's, opening a new facility, they might not have the staff. And so maybe you have staff that can help them on the, activation of a new facility. If they're trying to reduce cost, maybe you have something like ambient speech is one of the latest trends in healthcare IT. So that's, having a speaker that's in the room, listening to the provider and the patient speaking. Sometimes there's a family member in the room with them as well. And it's, by using basically a transcription, which then identifies, okay, this is the doctor, this is the patient, this is a caregiver, understanding the assessment that the doctor's doing, helping the doctor write the notes. I mean, the next stage of that is auto coding, helping doctors to save time. And I mean, where it's been deployed, the
Yeah.
results are fantastic. You hear doctors in the US, for example, saying things like, I had lunch for the first time in 10 years during my clinic. I saw my son's, practice
Nice.
for the
Nice.
first time. And
Yeah,
it,
that is really interesting.
I mean, that's where I think we'll see technology shifting and how it's implemented, is it's giving time back. to people. You see the same thing with ChatGPT or Gemini or Grok or whatever AI you use. If it's drafting emails for you, helping you arrange your schedule, I mean, you see the same trend happening at a macro level. But I mean, another aspect for me, Hakeem, is understanding that sometimes the technology itself isn't the obstacle or the hurdle. And I always remember my time in the UK and working with the NHS, and there's a very strong culture in the UK with the NHS. You can have the best technology in the world, but if you don't know how to navigate the cultural requirements in terms of budgets, how the organizations are set up, how people interact, you could have the best technology in the world and never get anywhere.
That's so true. That's and very happy you brought this. I have more question about the transformation, the technology in healthcare. Really interested to learn from you. But before we move, what would be an advice from your experience, your background, to someone maybe starting to step into a leadership role or taking that direction from your own perspective?
Yeah, no, I mean, there was a poster that the CIO at a hospital I was working with for a long time always had up. It was a quotation, and it's saying that God's strongest soldiers aren't chosen for the battle. The strongest soldiers are made through the battle, and you really need to seek out the experience. You need to jump into the fire. You need to be ready to fight. Nobody has 100% of all the skills when you're starting out, when you're growing professionally. And so it's important to, I won't say fake it till you make it, but you want to challenge yourself, put yourself in the position where you want to be. So if you have a group of other professionals you interact with and you aspire to be at their level, you want to be operating at the same zone, go and learn from them, sit with them, understand how they operate day in and day out, because that's going to enable you to pick up on cues and little characteristics, how they respond to customers and clients. And I've tried to do that throughout. I still try to, I mean, I'd say I'm learning every day, right? I'm not an expert in most things.
Me neither. Me neither, definitely. But really nice to hear, and it's inspiring because, of course, we all have high expectation of what we want to achieve, but sometimes we underestimate the process and also the failures. Like it's okay to fail sometimes, but definitely you do your best and you learn. Is something absolutely. I'm learning from you. I'm learning from everyone. Of course, comes to the platform. So really, thank you for this and. Moving a little bit more to the healthcare and IT, when you look at healthcare technology in 2026 and beyond, what are the two, three shifts you believe will define the next era?
Yeah, no, that's a great question. I mean, when I started in healthcare technology, EMRs were the future, like the electronic medical record. That was the latest technology. It was the newest innovation, centralizing IT, digitizing everything. The world's moved. Now everything's digitized, Hakeem. Like it's happened.
It's over.
So that piece of the puzzle's been commoditized, and there's a few things that are coming out in healthcare IT. I think one of the key shifts is not just acquiring data, but understanding how you actually use the data to create insights for clinicians. That could be on a clinical side, but it also can be on the revenue cycle sides. Understanding, for example, where a hospital can acquire more patients, advertise the services that they provide. I mean, I've got some good friends that work at large data and analytics companies, and a lot of what they're able to do is aggregate data across the different ways that patients are accessing a health system. So maybe you call the office, but then I've also got a WhatsApp message, and then I've got the website, and I've got my patient portal through their app. And I mean, what a lot of health systems are trying to do now is centralize all that, manage across all the different channels so you can really understand how the patient's interacting with your health system. That allows them to be more responsive to you. And that's one shift, or I would say like trend that's happening in the industry. Another is what I mentioned before about giving time back to clinicians. So using technology to enable people to deliver more care. I mean, there's not enough doctors in the world. There's not enough nurses in the world. And so anything that we can do to enable those clinicians to maximize the amount of patient time that they have and not sitting in front of a computer typing. We've all been in that
Yes,
doctor's office and you're like,
absolutely.
what are they doing? Like, I'm
Okay, right.
here. I'm here. Like, look at me, not the screen. So
Yes, correct.
anything we can do to give that time back from a clinical, and there's lots of solutions that are doing that. I mean, one thing I've worked extensively over the last few years is implementing like integrated infusion pumps. And so what a nurse used to take 15 clicks to program the pump, now they just say, okay, scan barcode of the patient, scan the pump, scan the medication, and then they click start once it's confirmed. And that's, proven to be safe. It's actually safer because you're catching a lot of errors. People misprogram the pump on accident, not intentionally, and then you're saving lives and time when you do that. So, um, those types of shifts, the ambient speech that's coming into play, there's a lot of newer technologies that are enabling health systems to give time back to their clinicians. And again, I'll just repeat what I was saying earlier about technology. I mean, I think the technology is here, but it's preparing the organization from a culture perspective to accept that change, to be ready to take it on, because these are transformational projects. I mean, there's some organizations that they don't do the billing anymore. They outsource it to another company that provides all the billing for them. And as they do that, it's a huge piece of their operation. And the organization itself is changing dramatically from a headcount perspective, from a top line, bottom line perspective. But if it's more efficient for them and their patients, it allows them to deliver care and focus on that instead of working on other things. The same thing's true with hosting. Why should a health system need to have a data center inside of it and
Mm.
need to have system engineers and database administrators and all the other roles that are required to effectively run a data center if they can outsource that at the same cost to any of the big cloud providers?
That's absolutely impressive. And I agree. The future is good, looking good with all what you mentioned, especially, I think, in my personal opinion, with the data sort of utilizing, to understand more about what should go right, what should go, maybe should move for a process or for structure or revenue or whatever is needed. So that's really interesting. Also, I think the time with patient is absolutely more important and something that should be utilized from the technology. But let's address the elephant in the room, of course, jobs. Would that mean also like AI will replace lots of job from people used to do sort of these things, or what do you think from your experience?
I mean, I spoke earlier about adaptability. Um, and then we've all seen the ads on YouTube, Hakeem. Like the future is going to be separated by people who do what they've always been doing and people who know how to use AI.
Yeah.
And so you really need to understand how you can leverage the technology. In some instances, so I'll use automated coding as an example. So that's when someone classifies, let's say you have a knee replacement or a hip replacement. There's different levels of how complex that is. And there's literally not enough coders in a lot of parts of the world to go through all the clinical documentation. It's a perfect use case for machine learning, artificial intelligence to go and read through and understand, okay, well, this patient is classified this, but did you also provide these two or three other services, which will bump it up a level? So those kinds of things are going to eliminate the need for some understaffed roles and at the same time raise revenue for hospitals. So again, so they can focus on their patients. Ultimately, there could be some roles that get I would say made obsolete, but at the same
Mm.
time, new roles get created. I mean, if you look 25, 30 years ago, there were still a lot of doctors that were dictating their notes and they'd have a little microphone and a recorder. And in between clinic rooms, they'd say, oh, this patient, 1, 2, 3, this is the diagnosis, this is the prescription, this is the impression and plan. A lot of that work that used to be typed by a medical secretary now can be done just through dictation, voice, where you've got that speaker in the room that listens and transcribes the full conversation, picks out the key points the same way an
Yeah.
AI note taker does that a lot of businesses are using now.
That's really interesting. If your son is stepping into healthcare, like starting, education, going to university, what would you advise him to develop in terms of skills? Thinking of AI, thinking of technology, thinking of jobs maybe that will not be there. What sort of skills or things that the new generation should focus on?
Oof.
On
That's a
spot.
great question. Yeah, yeah. My son's young. My son's only 8, Hakeem. Um, I'm telling my son to study hard. I'm telling him to find a couple things. Find something he likes, something he's good at, and something he's willing to work hard for.
Nice.
Most importantly, if you work hard at something, if you enjoy it and you're good at it, but most importantly, if you work hard, that's going to be the ultimate decider of whether or not you're successful. So number one is always put your full effort into it. Don't be lazy. I was telling my son the other day that champions are made in the off season, right? So
Yes, yes.
if you're working hard when other people aren't, that's going to push you up the ladder and make you more capable. There's this famous video, Hakim, from Kobe Bryant, and he talks about when he was 12, 13 years old, and he would see all the other kids that played basketball, and they were playing, I don't know, maybe 2 days, 3 days a week for an hour. And he quickly recognized, wait a second, if I play 5 days a week for 3 hours a day, um, I'm
That's
going to
great.
develop a lot faster. And so, I mean, from a professional perspective, if anyone that's new to the workforce, just find the work and go and do it. Work is changing, especially entry level jobs now with the world of AI. There's just less, I mean, there's less opportunity with the rise of remote working. There's fewer opportunities to learn from other people because you're not sitting in the same office with them all the time. And so, from that perspective, growing your network is incredibly important. I have to emphasize that. I'm part of multiple networking groups. And it's so interesting because a lot of the people that I worked with in the US when I moved to the UK, I still interacted with them. And then when I moved from the UK to the Middle East, and then some of those people moved to Australia or other parts of the world, and I still connect with them on a professional level. I mean, I've hosted, a CMIO from like Western Health in Sydney, Australia, in Abu Dhabi a few years ago after we met at a executive education course. And it's those kinds of relationships that help you develop beyond just this is my company and my role in the tunnel vision is take a wider view, take a step back, understand what's happening at a macro level to really maximize your knowledge, your network, your capability, your value.
I only mirror what you're saying. Definitely, networking is absolutely my top skill that anyone should develop. It doesn't matter which sector, which field, it doesn't matter. I think to prove it, that's why we're still talking today. That's why we're doing the podcast because we've been in network 10 years ago, maybe more. I mean, we've been in contact 10 years ago, and I'm really thankful for that. So thank you for bringing the network,
Likewise.
the relationships. Absolutely. It's a key. Moving a little bit towards
And
the end of.
Hakeem, if I can add
Yeah, sure.
one bit, I mean, I do a lot of mentoring and I talk to a lot of people that are, early mid career. I was meeting with an 18-year-old Emirati the other day, and she is fantastic. And like the things that she does blows my mind. And anyway, other friends are, I applied for this job, but nobody's responding. And what is unfortunately happened is that there's so many people that apply for any job that gets posted these days. I feel bad for the recruiters because they don't even have time to respond to everyone. I mean, you see a job posting on LinkedIn, there could be 1,000 applicants in the first 2 days. I mean, nobody's going to be able to give you a personalized response to all those. But I would say that, developing those relationships with the organizations where you want to work, finding somebody in the organization that cares, finding someone that understands that you care, you'll build that relationship, you'll get your foot in the door and just keep pushing. I mean, there's different things in different cultures, but where I come from, when you're young and you like somebody, you might ask them out on a date, but not everybody's going to say yes. You just need to keep asking enough people,
Yes.
and then you'll get
Yes, correct.
then you'll get that date that you're looking for.
Correct, correct. I'm really glad you brought this and great advice, especially for anyone trying to find a job. You're right. Some jobs would have thousands. I've been in recruiting before. I know that sometimes it take few seconds to read a CV, so you go through quickly. So connecting in a deeper level with a company, with, like you said, somebody who cares, there's somebody who can keep ears open to understand, is absolutely something that we all should learn about. Thank you for bringing this up. I'm gonna move to the last part of the podcast, and it's about more personal to your fatherhood, your investing, resilience. And you describe yourself as an active father, and you're also advising and investing. How do you stay grounded and consistent when your work is on high stakes?
Yeah. I mean, it's always going to be a challenge, and there's not enough hours in the day. Our time is our most precious resource. And I mean, when you talk about investing, and I mean, I started teaching my kids this, Hakeem, and I gave them some incentive. So I said, if you invest some of your money, I'll double it or triple it. And the only thing that you need to do is keep it invested for 12 months.
Nice.
And
I'm
that
gonna
way they're getting into that habit of using time for their own benefit. And in the same way, I mean, we're always, I would say, presented with more on the windshield than we can manage. And that there was a trick someone taught me long, long time ago. It just says everything's going to be divided in, an X and a Y axis, how urgent it is and how important it is. And where you really want to focus your time is on the things, obviously, number one, that are the most important and the most urgent. But the second most important is going to be the less urgent but highly important or strategic things that you can do. Sometimes it's okay to let that email not respond to it. Sometimes people will chase you. I'm always very responsive. I try to be extremely responsive, but eventually time is limited. So you can't respond to everybody all the time. So it's okay to let people chase you sometimes.
that's a good advice, and it's okay to say no sometimes as well. I would say I learned that sometimes you don't learn it, especially coming from the hospitality sector. You always want to say yes to everything, everyone, but you end up have no time for your own self or to do something. So what I learned definitely is it's okay to say no to the things that will not add any value or any impact to your life or to your work or to your whatever. So it's really a great advice. What habits had the biggest return on investment in your life? Some small habit or I don't know, something you do, ritual, whatever.
Yeah. So I'll share this maybe anecdote. Every morning I wake up and we all live in the same world. Like we all have these little screens that all day long distract us. And every day before I touch a phone, before I touch a device, the first thing I
Yeah,
do is I go and I take 5 minutes, 10 minutes. I sit down and I write down my to-do list. I say, what's the
nice,
most important thing to do? And if I'm going to be successful today, what do I need to accomplish? That could be exercising. It could be an important meeting. It could be delivering a project or a paper or proposal that you've been working on that you need to finish, but you really need to, number one, do that. I'm not going to share, but I've got my to-do list for today right next to me.
nice, nice.
That's, if you go back to the 7 habits of highly
And
effective
the
people
people,
from,
yes,
that's one of the things is keep a to-do list, right? So that's one thing. I love it. I love it. I
I
mean,
have,
one of the other things I think is we've all done that exercise where you have all the rocks and they need to fit in the jar.
yes,
And the rocks are all different sizes. And it's a anecdote or a metaphor for your time because some things just take more time. If you need to work on that proposal for 3 hours, you need to block off and fit those big rocks in first before you fill it in with all the smaller things that you can do. Like responding to an email, you can do in 5 minutes most of the time. So it's really saying, okay, well, these are the priorities, blocking off that time, managing your time effectively. I think that separates a lot of people that are floating and the people that are, you know, have a clear goal and achieve what they set out to do. So
nice. That's great. That's great advice. And the podcast called Level Up with Hakim. What does level up means to you?
leveling up, we'll use it. Once upon a time, I would say I know quite a few people that work at Amazon, and one of the concepts that they have at Amazon is anytime they're hiring someone, they should be a bar raiser. So what that means is that they shouldn't just be as good as the team. They should be as good as the best person on the team
Oh,
because they need to raise the bar or level up
nice.
the entire organization and team. I think the same thing's true anytime you hire somebody or you're looking for a partner or a client is, you know, find people that are smarter than you, find people that are more accomplished than you. Spending time with them is only going to make you more accomplished, is going to make you smarter. And that's part of where I'm trying to focus my time, my relationships is, put yourself where you want to be, put yourself with the people that you admire, the people that have accomplished a lot, and that'll eventually help you get to where you're trying to go.
That's amazing, Brian. Thank you so much. And before we close, what are you busy with? What are your next projects or something you're working on now for the audience to know about? your
Yeah,
responsibilities
of
now?
course. I mean, I recently left Cerner and Oracle after 20 and a half years, and now I'm working with two Oracle partners. So one is, an established software company, HEI Global Health, and they provide some of the best, revenue cycle management and patient accounting software. So we're growing that business here in the Middle East and beyond. And we're partnering with the other company I'm working with called S&P Universal. And S&P is a 30-year-old consulting business in the US. And they're again looking to the Middle East and other regions to grow their business. They have experts, clinicians, technologists. I'll say that can hopefully help health systems, but just helping those two businesses grow is where I'm focused right now. And um,
Nice.
that's I guess that's my title. Strategy and growth is just helping them to continue expanding their own businesses, and that's not just sales, right? It's how are you structuring? How are you recruiting?
Yeah.
What's the business entity strategy? How are you setting up bank accounts? I mean, all of the above fall under remit. So it's a lot of fun. It's chaotic. There's never enough time. So you really need to manage your time well,
Yes.
and that's a lot of it's a lot of
That's
fun,
it.
and
That's
it's a
it
good
already.
challenge.
Yeah, already. Brian, that was absolutely insightful and educational. Thank you for your time today, and I wish you all the best. Whatever coming next to you, we stay in touch, of course. And if you ever in Europe, shout out definitely.
Will. I will. Thanks for the opportunity. Hakeem. It's been a lot of fun to catch up. I
same,
appreciate it.
same here. Every conversation can and will elevate you. It's where real talk meets real growth. After